The type of arthritis I have is rheumatoid, which is one of the inflammatory arthritises. I was aware that I had some sort of problem with my hands because they were swelling badly and they were bright red. Between actually being diagnosed and getting the better form of disease-modifying drugs took probably 5 years or so. I've actually ended up with a lot of orthopaedic surgery. So I've got 2 replaced knees, 1 replaced hip. I've had surgery on a shoulder, and that obviously affects your whole life.
Inflammatory arthritis affects quite a substantial proportion of the population, and if we look at rheumatoid arthritis, which is the commonest by far of these inflammatory polyarthritides, we're looking at about 1% of the population. So if the AHSN, ours serves a population of about 3 million, we're looking at about 30,000 people with rheumatoid arthritis. And that's why it's really, really important to be able to identify this group of disorders early and to intervene early, because with early intervention you get the best long-term outcomes. And given that they're chronic lifelong diseases, you want to preserve the health of the patient right through the lifetime of the condition. The group meets face-to-face, and we meet at one of the various hospitals within the network, and so that's very nice because it means we can see one another's facilities and get to know one another's hospitals, and we discuss a variety of issues on an agenda and begin to look at some of the innovations that we can tackle together and implement.
So I think one of the strengths of the network to date has been the levels of engagement that we've seen across the region. So we have a core group of consultant rheumatologists who lead the activities, but we've also seen engagement from specialist nurses, pharmacists and registrars throughout that as well. Just a few of the projects that we've got ongoing in the Early Inflammatory Arthritis Network include helping our partners take full advantage of the opportunity that's arisen from the introduction of biosimilars in rheumatology. We're trying to address the variation in GP education around the sort of symptoms, referral pathways for early inflammatory arthritis.
My role is to provide a patient perspective and patient experience to what's going on clinically. I think it's very important for any clinician to have a patient perspective, because if you haven't had it, you can't imagine what it's like. And I think that applies to an awful lot of illnesses right across the board, not just rheumatology.
So we had particular difficulties with getting to see our patients quickly, and working with the network helped us to bring attention to our services from the management in the trust and increase the staffing levels at the specialist nurse levels, and that really transformed the services so far.
I've found it particularly interesting having a patient representative here. Seeing their point of view about things like biosimilars has been very interesting, because perhaps she's brought thoughts to the meeting that weren't necessarily what I expected or even what my patients are saying in clinic.
I think it's been really useful in terms of sharing experience, sharing different ways of doing things, looking at ways of optimising patient care, and also being unified as a group, that we can actually face the managers and CCGs and say, actually this is something that is important on a regional level, and this is what our colleagues are doing elsewhere.
There's been an enormous interest in doing this particular piece of work. People recognise the fact that the earlier we can diagnose arthritis and the quicker that we can get patients looked after and treated, the more successful we will be in managing their condition. The hope is that the network will continue to meet and grow and will be an inspiration to other regions.
It's really useful to be part of this network. By working together, we should be able to improve the long-term prognosis of patients with newly diagnosed inflammatory arthritis.
I hope it will improve patient access, support, treatment, and make life easier for people.